Heart disease. Heart disease kills 9 million people every year, more than any other cause, and most of it is preventable. Your heart pumps blood through arteries. Over time, those arteries clog with plaque, a buildup of fat and cholesterol. Blood flow decreases. The heart works harder. Eventually, a clot forms or an artery blocks completely. That's a heart attack. The risk factors are well known: high blood pressure, high cholesterol, smoking, obesity, diabetes, lack of exercise. Most people dying from heart disease had warning signs for years before the fatal event. Prevention isn't complicated. Exercise 30 minutes most days, eat more vegetables, less processed food, don't smoke, get your blood pressure and cholesterol checked regularly. These aren't secrets. They're just hard to do consistently. The tragedy is how predictable it is. Doctors can see it coming decades in advance, but people don't feel it until something ruptures or blocks. Stroke. Strokes kill 6 million people annually. Millions more survive with permanent brain damage. A stroke happens when blood flow to part of the brain stops. Either a clot blocks an artery or a blood vessel bursts. Brain cells start dying within minutes. The longer without treatment, the more brain tissue lost. Time is everything. Recognize the signs: face drooping on one side, arm weakness, slurred speech. If you see these, call emergency services immediately. Treatments exist that can dissolve clots, but only within a narrow time window. Every minute of delay costs neurons. Prevention overlaps with heart disease. Control your blood pressure. It's the single biggest risk factor. Stop smoking. Exercise regularly. Manage diabetes if you have it. The scary part is the randomness of outcome. 2 people can have identical strokes. One recovers fully, one loses the ability to speak forever. Now, speaking of tools that can actually help you stay informed about your health, let me tell you about something I've been using. ChatLLM by AbacusAI. You go to chatllm.abacus.ai/EYJ and you get every major AI model in one place. ChatGPT 5.4, Gemini 3.1 Pro, Claude Opus 4.6, Grok 4.1, DeepSeek, all of them. Their Route LLM feature automatically picks the best model for whatever you're asking. So if you want to research symptoms, understand a diagnosis, or just learn more about any of these conditions, you're getting the smartest AI for that specific question without choosing manually. It also does AI image generation, video generation, presentation building, and they have a deep agent that can build entire apps and websites for you. All of this for $10 a month. That's cheaper than subscribing to any single AI separately. Visit chatllm.abacus.ai or click the link in the description and pinned comment. COPD, chronic obstructive pulmonary disease, kills 3.2 million people yearly. It's a slow suffocation that takes decades to develop. COPD destroys air sacs and inflames airways. Both make breathing progressively harder. What starts as occasional shortness of breath becomes inability to walk across a room. The cause in most cases is simple: smoking. Around 80 to 90% of COPD cases trace directly to cigarette smoke. The remaining cases come from air pollution or occupational dust exposure. If you smoke, COPD is probably already starting in your lungs. Lower respiratory infections. Lower respiratory infections kill 2.6 million people every year. Pneumonia is the main culprit. These infections attack the lungs. Bacteria, viruses, or fungi invade, causing inflammation that fills air sacs with fluid. Breathing becomes difficult. In severe cases, oxygen can't reach the bloodstream. The body slowly suffocates. Children under 5 and adults over 65 face the highest risk. Weakened immune systems can't fight off infections that healthy adults clear easily. Pneumonia vaccines exist and work. Influenza vaccines reduce complications. Hand washing prevents transmission. In wealthy countries with good healthcare, most respiratory infections are treatable, but in regions without hospitals or medicine, these infections remain devastating. Lung cancer. Lung cancer kills 1.8 million people annually. It's the deadliest cancer worldwide. Cancer begins when cells mutate and multiply uncontrollably. In lung cancer, tumors destroy lung tissue and spread throughout the body. By the time symptoms appear, the cancer has often metastasized. Late detection means low survival rates. Smoking causes roughly 85% of lung cancer cases. Cigarettes contain dozens of carcinogens that directly damage lung cell DNA. More cigarettes, more years smoking, higher cancer risk. The lungs can heal remarkably well if given the chance. Alzheimer's and dementia. Dementia claims 1.6 million lives yearly. Alzheimer's disease accounts for most of them. Dementia isn't normal aging. It's the destruction of brain cells controlling memory, thinking, and behavior. People forget their children's names. They get lost in their own homes. Personality changes. The person disappears while the body remains. We don't fully understand what causes Alzheimer's. Prevention is less certain than with other diseases, but patterns emerge. What's good for the heart appears good for the brain. Exercise, healthy diet, social engagement, mental stimulation. Unlike sudden death, families watch loved ones vanish gradually. Diabetes. Diabetes kills 1.5 million people directly each year. Millions more die from complications it causes. Diabetes disrupts how your body processes sugar. Blood sugar rises to dangerous levels, damaging blood vessels, nerves, kidneys, eyes, and heart over time. Type 2 diabetes, most common form, is largely preventable. It's driven by obesity, poor diet, and lack of exercise. The body wasn't designed for constant sugar intake and sedentary living. When you flood the system with more glucose than it can handle for decades, the system breaks. Prevention and early management work. Lose excess weight, exercise regularly, eat fewer processed carbohydrates. These changes can prevent type 2 diabetes entirely or reverse it in early stages. The complications are what kill. Heart disease accelerates, kidneys fail, limbs require amputation. Diabetes doesn't always kill directly. It weakens the body until something else finishes the job. Diarrheal diseases. Diarrheal diseases kill 1.5 million people annually, almost all in places without clean water. Contaminated water and food carry pathogens causing severe diarrhea. The body loses fluids faster than they can be replaced. Dehydration follows. For children and the malnourished, dehydration can turn fatal within hours. In developed countries, diarrheal disease rarely kills. Clean water treatment and sanitation make deaths exceptional. These aren't advanced technologies. They're basic infrastructure much of the world lacks. Prevention is about systems, clean water supplies, proper sewage treatment, vaccination against rotavirus. When these systems exist, diarrheal disease becomes a minor inconvenience instead of a killer. The tragedy is how solvable this is. We know exactly how to prevent these deaths. The interventions are cheap and proven. Yet 1.5 million people still die because they were born somewhere without functioning water systems. Kidney disease. Chronic kidney disease kills 1.3 million people yearly. Your kidneys are failing slowly, and you probably don't know it. Kidneys filter waste from blood and regulate fluid balance. When they fail, toxins accumulate. Eventually, without dialysis or transplant, the body poisons itself. Most kidney disease develops silently. There's no pain as function declines. People lose 70% of kidney function before symptoms appear. By then, damage is irreversible. Regular blood tests catch problems early. Most people don't get them. Diabetes and high blood pressure cause the majority of kidney disease. Control these conditions, and kidney disease risk drops dramatically. Also, avoid overusing painkillers like ibuprofen. They damage kidneys with chronic use. Once kidneys fail completely, options narrow: dialysis or transplant. Prevention means avoiding this fate entirely. Tuberculosis. Tuberculosis kills 1.3 million people each year. An ancient disease humanity still hasn't defeated. TB is a bacterial infection attacking the lungs. It spreads through air when infected people cough. The bacteria can remain dormant for years before activating. When active, it causes coughing, weight loss, night sweats, and eventual death without treatment. Treatment exists and works. A 6-month antibiotic course cures most cases. The problem is access and completion. Many infections occur where healthcare is limited. Patients start treatment, but don't finish, breeding drug-resistant strains. Prevention involves identifying and treating active cases before they spread. Better ventilation reduces transmission. Nutrition strengthens immune systems. TB thrives in poverty. Crowded housing, malnutrition, limited healthcare. The deaths continue because resources don't reach everyone. Liver disease. Liver disease kills 1.3 million people annually. The liver processes toxins, produces proteins, and performs hundreds of vital functions. It's remarkably resilient, able to regenerate from damage, but sustained assault eventually overwhelms it. Cirrhosis is irreversible scarring. Scarred liver can't function. Failure follows. Alcohol is the most common cause in developed countries. The liver processes alcohol into toxic byproducts. Heavy, chronic drinking doesn't allow recovery time. Damage accumulates until cirrhosis develops. Hepatitis B and C viruses cause most liver disease globally. Vaccines prevent hepatitis B. Hepatitis C now has a cure, though access remains limited. Fatty liver disease is rising rapidly, driven by obesity. Even without alcohol, excess fat causes inflammation and scarring. Prevention means limiting alcohol, vaccinating against hepatitis, and maintaining healthy weight. The liver will forgive a lot if you stop causing more damage. Road accidents. Road accidents kill 1.2 million people every year. Most are young, most were preventable, and the numbers keep growing. Traffic deaths follow patterns. Speed kills. Alcohol impairs. Seatbelts save. Helmets protect. Distracted driving destroys reaction time. Every accident investigation reveals the same factors. We know what kills people on roads. We just keep doing it. Individual prevention is straightforward. Wear seatbelts. Don't drive drunk. Don't speed. Put down the phone. Wear helmets on motorcycles and bicycles. Systemic prevention involves road design, vehicle safety standards, and enforcement. Countries implementing these measures see deaths drop significantly. The frustrating truth is that road deaths are completely solvable. The solutions exist. Implementation is the problem. Meanwhile, 1.2 million people die annually in incidents we know how to prevent. HIV/AIDS. HIV/AIDS kills around 650,000 people yearly, down from nearly 2 million at its peak, but still devastating. HIV attacks the immune system, specifically the cells coordinating immune response. Without treatment, the immune system weakens until it can't fight infections. This stage is AIDS. Death follows from opportunistic infections or cancers. Treatment transformed HIV from death sentence to manageable condition. Antiretroviral drugs suppress the virus, allowing normal lifespans. They also reduce transmission to near zero. Prevention works at multiple levels. Condoms prevent sexual transmission. Clean needles prevent transmission among drug users. Pre-exposure prophylaxis prevents infection in high-risk individuals. Testing identifies infections early. The remaining deaths concentrate where treatment access is limited. The medical problem is solved, the access problem persists. Suicide. Suicide takes approximately 700,000 lives every year. For every death, many more attempt. Suicide results from pain exceeding coping resources. Depression, trauma, substance abuse, chronic illness, financial ruin. When suffering feels permanent and solutions invisible, some people see death as the only escape. They're wrong, but in that moment, they can't see alternatives. Most suicides involve warning signs, talking about being a burden, giving away possessions, withdrawing from activities. Recognizing these signs and intervening saves lives. Prevention starts with treating underlying conditions. Depression is treatable. Access to mental health care matters. Stigma that prevents help-seeking kills. Reducing access to lethal methods during crisis creates time for the impulse to pass. The tragedy is that most survivors of attempts report immediate regret. The permanence of the solution vastly exceeds the permanence of the problem. Malaria. Malaria kills around 600,000 people annually. Almost all are children in Africa. Malaria is caused by parasites transmitted through mosquito bites. The parasites multiply in the liver, then attack red blood cells. Fever and illness develop. In severe cases, death follows. Children under 5 lack the immunity that repeated exposure builds. Prevention centers on mosquitoes. Insecticide-treated bed nets create barriers during sleeping hours. Indoor spraying kills mosquitoes. Draining standing water eliminates breeding sites. These simple measures dramatically reduce transmission. Treatment works if received quickly. Anti-malarial drugs clear infections within days. But children in remote villages can't access treatment fast enough. A vaccine now exists and is rolling out. Combined with prevention methods, it could save hundreds of thousands of lives. Malaria is another disease we know how to prevent.
The deaths continue because solutions require resources reaching the poorest regions.
A child's survival depends largely on where they were born.